awareness and increase knowledge about healthcare reform. And we're hosting this healthcare town hall meeting to inform the Richmond community. And I thank you for coming out tonight. I hope you enjoy the panelists. And we will have question and answer following the panelists speaking. First speaker is Dr. Rick Mays from the University of Richmond. Rick Mays is an associate professor in the University of Richmond's Department of Political Science and a faculty research fellow at the Peters Center on Healthcare Markets and Consumer Welfare at the University of California, Berkeley. He received his PhD from the University of Virginia in 2000 and a National Institute of Mental Health postdoctoral training at the UC Berkeley School of Public Health from 2000 to 2002. In the early 1900s, he worked on Medicaid policy in the White House for George Bush Sr. and thereafter on health insurance and Medicare policy at the AARP during the Clinton administration. He is a graduate of the University of Richmond. He has written many books, and he's the author of Universal Coverage, and just to name a few. His most enjoyable and rewarding professional experience have involved taking groups of University of Richmond students to Peru on healthcare, risk research, and community service trips. Please welcome Dr. Rick Mays.
We're having an interesting conversation right before this, and it just reveals how complicated this debate has come. I think Andrea and I both would love to see really good reform. I'm mildly optimistic at the end of today that something good is going to come out of this, and she's also reminding me that this package that's emerged has both good things and bad things, things to be concerned about, things to be encouraged about. And I think that's where a lot of Americans find themselves right now, trying to figure out, is this something that's good? In fact, even the details of it are just now slowly emerging. Let me give you a little background as to why we have spent the last 9 months in this torturous discussion about healthcare reform. Just to give you some numbers to show you over the last decade what has happened to health insurance. And from just hearing your all's conversations before this panel got started, I doubt these numbers are going to be shocking to you. I doubt they'll be new to you, but for a lot of my audiences, especially my students, who they don't even think in terms of health insurance. That's something their parents have. They have a card somewhere in their wallet if something happens. But the cost of health insurance is not high on their list until I actually showed them that if you actually look at tuition at any institution, tuition's gone up way beyond the rate of inflation. And if you actually break out each year those individual increases, like what is causing those 10, 11, 12% annual increases in tuition, the single biggest thing is healthcare costs. That's when I show students, you may not care about health care because you think you'll never need it. You're at the invincible stage of life. But you care about tuition, and it's going up a lot because of healthcare. Colleges and universities are hugely labor intensive. When their health insurance costs go up, they just turn right around and increase their tuition. So, again, the proportion of American workers that can even have health insurance has fallen significantly, as all of you in this room know. The number of companies that can afford to offer it has fallen from 69% to less than 60%. Health insurance has just gotten too expensive for a lot of small employers to offer. And look at the cost. I always pull out my health insurance card. That is the exact same Anthem WellPoint card I've had for the last 10 years. The only thing that's different on that card are the co-pays, deductibles, and the pharmaceutical costs. But the cost of that card for me and my family has gone from, when I started at U of R, it was $6,000, $6,500. Now it costs the University of Richmond, it now costs about double that to provide the same coverage to me. And nothing has changed. I don't have more comprehensive coverage, I don't have better coverage, I have the same coverage. Could you go to the next slide, please? Look at this line. The top line is the rate of increase in health insurance premiums. The bottom two lines are increases in wages over that period in inflation. Now, I don't care what that line is. That line could be chocolate bars. That line could be what it costs to go to church. I'm glad church is free, thankfully. But if that was the cost of going to church, church would be too expensive for more and more Americans. That is literally unsustainable. And this is what I always want to say. I speak to a lot of provider groups, and for whatever reason, the ones I keep getting are fairly hostile to all kinds of reform. And I just want to keep saying, be careful, because your product is going to eventually be priced out of most people's reach. If this kind of line is not bent back, this is the curving of the cost line, if we can't get control of that, the problems get worse and worse. Yes?
Do you have any statistics that go back another decade, like
I wish not on this slide.
1990 and 1980 and so forth?
During the 90s, this is a different story, but managed care over the course of the 90s squeezed that health inflation increase, but it ended up doing so by very, very aggressive selective contracting, which doctors freaked out about and hospitals freaked out. So we're kind of back to runaway inflation. Here are some consequences. If you don't have health insurance, compared to if you do have health insurance, now again, I don't want to paint the picture that if you have health insurance, you're scot-free, you're fully protected, you're not. But it's infinitely worse to be uninsured. No usual source of care. Many more people who are uninsured don't have a usual source of care. Postponed care, 26% postponed care if you're not insured. Needed care, but didn't get it, 15%. Medical bills that had a major impact. 30% of people who are uninsured are not just uninsured, which is bad enough, but they have costs for previous care that are debt for them. So, should you go down a couple more slides? Sorry. That's good, that's great. The top 3 points are just, again, showing how if you don't have health insurance, you're at increased risk for greater injury, illness, and even death. The last one, I want to talk more about the last one. I had to update the bottom of the slide, given the recession that we've had in the last year, which has been absolutely horrendous. Every year, and we're the only industrialized country in which this reality is a reality. Every year, it's now approaching 1 million families are bankrupt in this country by medical debt. And the scary part about that is 80% of those families have some form of insurance. But what often happens is they're out of work, so they lose income, or they have a chronic condition and they constantly have co-pays and deductibles that exhaust their limits, exhaust their disposable income, and they end up declaring bankruptcy. These are all slides of statistics and they're trend lines and they're interesting. Can you go to the next slide, Letitia? I was trying to throw in a slide that says that number, 900,000, is an aggregation of people just like this. It's individuals who make up that figure. These are the Dorsets, middle-class family in Columbus, Ohio. He works for GE, solidly middle class. He makes about $75,000 working for GE. That's their 3-bedroom house. They're making monthly payments on. There are minivans in the garage. Their middle son, Zach, developed an autoimmune disease. Who asked to develop an autoimmune disease? What kid asked to have an autoimmune disease? Developed an autoimmune disease, and that's the kind of chronic condition I was talking about. But he has to go see his physician regularly. He has to be admitted to the hospital to moderate his medications occasionally, but occasionally is several times a year. And when you're making house payments and you're just trying to pay off your car and live a middle-class lifestyle, and $75,000, which is far above the poverty line, you're not going to qualify for much of anything. Well, in the end, the Dorsets are one of those 900,000 Americans that declare bankruptcy, and that's horrendous. They lose everything, they lose all the equity, they have to sell everything because their child got sick. And I think this is where we can differ on some of the details, but God Almighty, if we can't make progress on this.
Board is prone to feedback. Check. 1, 2.
Our message. We will not be deterred. Now, this is a slide I always try to show this to my medical student groups because maybe it's just the groups I keep pulling, but they start, we don't want any, this is socialism, and we don't want the government involved in health care. I always want to say to the med students, half your tuition is being offset by Medicare's graduate medical education subsidies. Relax for a second. About 2/3 of physicians, depending on how you ask the question, are broadly supportive of reforms of public and private forces. There's about 1/3 who are absolutely opposed. And I think this is, I don't want to disparage the opponents of reform, I don't want to caricaturize them, but they tend to be the loudest. They tend to be the ones you hear the most. The forces that are looking for pragmatism and reform aren't the ones who scream and go crazy at town hall meetings. So I always show the slide to show you that, or show any audience, that it's that third that's the loudest that gets the bulk of the attention. But there's
Check. 1, 2.
a lot of text. I'm not going to go through all that. What kind of reform are we going to get? This slide is pretty much current up until this last iteration of reform, and who knows what the exact details are. No, I don't know. I'm not that pretty. But for audiences who are basically asking, what are we getting? Like, we're getting, so far, something that's basically been done in Massachusetts. Massachusetts is a very pragmatic approach to achieving universal coverage. It builds on the existing models, and I know that we're going to have other speakers who are going to point out the flaws in our existing insurance companies and our insurance arrangements, and I would agree with those. But I was there in 93 and 94 during the Clinton. I was praying then too, and we got nothing. It was devastating to get literally nothing. So I'm a little more of the, I'm a little more agnostic on the exact details. I want to see something happen. If what goes through